Hi everyone, I'm Bevin Victory with Bevin Victory Doula and Birth Services in Cleburne, Texas. And I'm here today to talk to you a little bit about a doula and what exactly that means, because a lot of people aren't really sure. So I teach childbirth education classes in Cleburne, and I also offer doula services. And a lot of people are like, oh, what's that? What's a doula? What does that word mean? So the textbook answer is that a doula provides physical, emotional, and informational support to couples during their pregnancies. And a lot of people are like, oh, that sounds awesome, but what exactly does that mean? So I just want to explain a little bit more. So physical support during labor means helping with physical comfort measures for the labor and the birth. So things like massage and things like positioning, changing positions to help have the most pleasant labor experience. I help with things like rebozo and just kind of different comfort measures to help make mom comfortable. Emotional support means that I am kind of like your best friend for labor. So that means I have a relationship with the couple and I help support them emotionally with whatever path their labor is taking. So if it looks exactly how they planned, that's awesome. I'm there for you. If it doesn't look exactly how you planned, it's great to just have someone there for you to listen and understand what all is going on and help you deal with the emotions that are coming up for mom and dad during labor and birth. And then lastly, informational support means that I know a lot of stuff about birth. So doulas like to say that dad knows mom really well, and then doulas know birth really well. So together we make a really good team to help give mom a great experience. So that's another thing that I want to really clarify, is that I am not like a birth coach. I don't replace dad. I am there for both mom and dad. Hi, Rebecca. Hi, Mackenzie. Hi, Reagan. And I just really like to emphasize to my couples that I am there for both of them, and I'm part of the birth team for y'all, and we're all working together to support mom. So I am great at giving dad ideas of helping comforting her and making him look like a rock star, like getting him up there by her face if that's where she needs him, and giving her affirmations, or having him on her back doing hip squeezes and massage, and she's going to just really appreciate him and the role that he's playing there. Okay, so that's a little bit about what it looks like. I also want to tell you what a doula doesn't do. Doula does not take over for dad. Like I said, I'm not a birth coach that comes in and is like, okay, I got this. I'm telling mom everything what to do. I come in and I make sure both mom and dad have their needs met. So make sure that they're both eating and drinking and going to the bathroom. Dad can get breaks. Dad can go get rest if he needs to. And mom's not left by herself. So not taking over for dad. Also, what I don't do is I'm not an advocate for the couple at the time of birth, and I don't go in and tell your midwife, your doctor, this is what she wants, this is what's going to happen, type of thing. What my job is to facilitate that communication between you and your provider. So I can help you with what questions to ask, and help you with making your informed decisions for whatever's coming up for your labor and birth, but I don't come in and stand between you and your doctor and advocate and do all that during your birth. Okay, so that's a common misbelief. And then the other thing that I don't do is I don't do medical stuff. So I'm non-medical support for your labor and your birth. So I don't deliver babies, I don't do vaginal exams, I don't take baby's heartbeat or blood pressure, stuff like that. That's all for your doctor or your midwife. Okay? Next question that I get a lot is, what's the difference between a doula and a midwife? So a lot of people say, oh, you're a doula, you deliver babies. And no, that's not the case, although a lot of people kind of interchange those words, and it's kind of conveyed on TV that sometimes doulas deliver babies, but that's not the case. So what a midwife is a midwife helps with medical care for low-risk pregnancy, and would replace an OB. So you would see a midwife for all of your regular prenatal visits, and then your midwife delivers the baby. And then doulas do the non-medical support. They just kind of help at the birth with the physical support, the emotional support, and is your birth BFF, or your birth concierge, some people like to say. Okay, kind of help make everything happen the way you want it to and be that loving support for you. So, yeah, that's the difference between a doula and a midwife. A lot of people also ask, why do we need a doula? And it's not really common in our culture yet for people to expect to have doulas, but a lot of people are kind of figuring out that doulas can help you have an awesome birth experience. And a lot of times in our culture, people say, well, the most important thing is healthy mom, healthy baby, and that is totally important, but it is also really great if you can have a positive experience as well. So doulas can help you have that positive, loving birth experience that you just really enjoy, and it gets you off to an awesome start as a family with your baby. So a doula can help you have a positive birth experience. Also, people are realizing that doulas can help reduce the need for medications, help reduce the need for interventions, help reduce the C-section rate, which is huge. People are realizing that just having that emotional and physical and loving support from mom can help her just have a healthier labor and birth. Okay, so that is just some of the awesome things that doulas do. And a lot of people also think, well, a doula, picture a home birth with a midwife and a doula there, and they say, well, we're having a hospital birth. Why do we need a doula? And that is awesome to have a hospital birth, and I think hospital couples need doula support almost even more than home birth or birth center couples do, because you may totally love your doctor and the nurses, and you have awesome, wonderful providers, but they have other couples that they're having to take care of at the same time. So they come in and they love on you and they help you have a good experience, but then they have to go to the other mom birthing next door. So your doula, who you hire, is someone who is there for you the whole time, continuous. Doulas usually join you at your home while you're in active labor, and then help you decide when to go to your birthplace, to the hospital, and then they stay with you until you've had your baby. So it's really awesome to just have someone there with you continually, and they don't have to like go out and help with other laboring clients. So that is one awesome thing. A lot of times hospital couples also don't know all the information of stuff that could come up during your labor and your birth, and doulas can help provide that informational support and say, well, this is kind of the questions to ask about the procedure that you're considering, and you can ask about the benefits and the risks and all that good stuff. So they have a little more background knowledge than probably the average person. Let's see. People also say, well, I have my husband, or I have my mom, or I have my friend. I don't really need a doula also. That's a lot of people in the laboring room. And that is a great point. And that is awesome that you're going to have a supportive husband there, or your mom there, or your best friend there to help you during that labor time. But like I said earlier, all those people know you really well, but they may not have ever seen a birth before or seen a woman in labor before. So doulas add that professional birth support of someone who has been around a laboring woman who is in pain and is okay with it and knows how to help her and doesn't just get emotional. A lot of husbands don't like to see their wife in pain naturally, so they are not quite sure how to handle that emotionally. And a doula can help give ideas and give him hands-on tools to help her cope. Okay, so yeah, it's great to have that support, but why not have more support and someone who knows birth and knows kind of how to navigate that situation? All right. Another question I have that I get is, we're already spending a lot of money to have this baby on our medical costs. Why should we put up the money to hire a doula as well? And that is a great point, because I know that birth is expensive, especially if you're birthing out of hospital. You can have a lot of out-of-pocket costs. So a lot of people think, well, extra money, extra person in the room. But I like to tell couples, you're only going to birth this baby once, and it is your experience, and the doula can help you have a more positive experience. So kind of thinking about weddings in our culture, people spend a lot of money and a lot of time to prepare for their wedding, and it's a big important day, but so is a birth. And our culture is not really geared towards investing a lot of money and time preparing for that important day. And so it's just kind of a different way to look at it, is saying, yeah, it's a lot of money, but it's a big event. It's a big life event. And it really helps families if it's a positive experience for moms and dads to bond with that baby and get them started into parenthood. So yeah, I have not talked to any couples or dads who've regretted the money that they spent on a doula, because when the time comes to it, it's something you haven't been through before, and it helps to have a knowledgeable person helping you. Okay, and then the last question I wanted to include is, what all does the doula package include? So obviously the birth, but with my packages you get a prenatal visit where we will talk about your birth preferences, your birth plan, talk about what kind of comfort measures you like. We'll probably practice some relaxation. And then I would go on call for you from 38 weeks to 42 weeks. And during that time, if you want to text, if you want to call, if you want to say, hey, this is going on, I'm feeling uncomfortable, is there anything I can do? I love giving suggestions or saying, nope, you're doing great, or call your provider. I love to say call your provider, but I love to just be that emotional support and someone that you can call or text if you have a question, which is really great for first-time parents who are not sure what exactly is going on some of the times. So on call for that birth, whenever you go into labor, I will join you during active labor, usually join you at your house, and then go with you to the hospital or the birth center, or if you're staying home, and then stay with you until baby's born, help you establish breastfeeding, help you get all tucked in, and anything else that you need. And then I will check with you a couple days after baby's born, see how you're doing, and then we'll schedule a postpartum visit. So that's what my packages include, and there's more information on those on my website at victorydoula.com. And I would love to talk with you about supporting you in your birth, because that is something that I love to do. So let's see if I can see any questions that came up. Just some people saying hi. Good morning. Thank you all for watching. Let's see. Mackenzie asked, I was going to ask if doulas work well with hospital births as well. Yeah, so I think I covered that. Hospital births can really use the help of a doula to get that personal support and have someone who's there with you continually and just on your team no matter what path your labor takes. Rebecca asked, do you have a preference on in-hospital or out-of-hospital births? And I don't. I love supporting couples in whichever environment they're in. So I really enjoy hospital births. I really enjoy out-of-hospital births. And like I said, I think a lot of times hospital births need that support even more than the out-of-hospital births. But I love all of them. Okay, so thank y'all for your questions. And I hope everybody has a great day. Bye-bye.